dear friends, I'm Dr. Khan, and today I'm going to be talking about the drug amlodipine, which is a common blood pressure medication. I'm going to talk about how it works so we have an idea about how it actually does its job and the side effects that we all want to know about, okay? As well as I'm going to talk about the contraindications of this drug, meaning basically when you should not be taking this medication and when your doctor will not be prescribing this to you, all right? I'm also going to talk about what you can do to actually prevent or reduce the severity of these side effects. And if you want me to talk about any other blood pressure medication, let me know in the comments below. I would love to cover that medication as well. Alright, so a couple of uses. Hypertension, high blood pressure is of course one uses for this medication. It is a good medication with fewer side effects and not as many interactions, although there could be a couple of interactions with this medication. The next common use for this medication is for angina. Now, angina is when you have pain in your chest due to tight vessels of your heart. So this medication can be used as a second-line therapy. It is not the first-line therapy, but if you're not good with the first-line medication, normally beta blockers that your cardiologist may prescribe to you, amlodipine can be used for people who have pain of their heart due to angina. That again happens when your blood vessels are tight in your heart. Now, number 3 common use for this medication is for Raynaud's phenomenon. This is when your fingers turn cold and pale and numb. This could happen when it is cold outside. This could also happen when you are under lots of stress. And this medication, amlodipine, can actually help reduce the severity of your problems. Okay, so now how does this medication work? You should not just pop a pill, you should know actually how it is working. So this actually is a muscle relaxer. Now when this medication makes the muscle of your vessels relax, it leads them to dilate, open up a little bit. Take the example of a water pipe. So you have a tight water pipe and water is flowing through it. There's going to be a lot of pressure. But if you open up that water pipe somehow and you have the same amount of blood flowing through it, then the pressure on the walls of the pipe will be reduced. Similarly, amlodipine or Norvasc basically acts in a similar manner. So it happens that the blood vessels in your extremities, your arms and your legs actually dilate, open up, leading to reduced blood pressure. Same thing happens in your coronary vessels, in your heart vessels. It can potentially lead to opening up of your vessels in your heart, thus reducing angina, reducing chest pain that happens with a tight vessel in your heart. Okay, so now moving on to the adverse reactions or the side effects of this medication. As I said before, this medication is a great medication and lots of people do very well with it. But if you had any of these symptoms or any other symptoms or side effects from this medication, amlodipine, let me know in the comments below. Now, number 1 is going to be what happens in about 10% of the people. It actually happens a little bit more in females. So this is called peripheral edema. This is when there's fluid accumulating in your ankles or in your legs. This happens in about 10% of people, as I mentioned, and this could actually be bothersome for a lot of people. So what I recommend people is that when you're starting off with this medication, try to go on a lower dose, 2.5, then gradually increase it to 5. And if you really need to, move it up to 10 milligrams, which is considered to be the highest dose for this medication. The other thing you can do is you can walk around, you can do a little bit more walking. That will lead to your calf muscles actually pumping more fluid outside of your legs towards your body. So this could help prevent this side effect, and the medication that is normally considered a good medication for high blood pressure, you can still continue to use this medication. Now about 2 to 3% of the people could have flushing. So you can have flushing of your face because this does dilate your blood vessels, open up your blood vessels, so there may be more blood flowing into your face. It could also actually cause palpitations in about, let's say, 4 to 5% of people. It could cause palpitations. This also happens a little bit more in ladies and females. Less than about 2% of people can get a skin rash or can get some itching of your skin. Less than 2%. So if you're having this, don't think it is due to amlodipine, but if this is happening in conjunction with your initiation of this medication, basically when you start this medication and a few days or weeks down the line you're having these symptoms, then you can tell your doctor, hey, this is what I have been noticing. Could it be the amlodipine that we started? Alright, you could ask your doctor like that. Next, about 2% of the people could have stomach problems. You can have pain in your stomach. You can also be a little nauseous, but just about 2-3% of the people. So this is not a lot. So of course, if you're taking this medication for a long time and you've been okay and you're getting some abdominal pain or some nauseousness, it is probably not the Norvasc that is causing it. Of course, always check with your physician. Now again, few people could have dizziness. They could be lethargic, they could be drowsy, they could feel weak, fatigue. About 4 to 5% of people could feel fatigue with this medication. So if this is the only change that has happened with you, then of course check with your doctor and let your doctor know, and let your doctor decide what could be happening to you. Now, a very few group of people, less than 1% of the people, can have a significant rash type reaction all over the body called erythema multiforme, and that could be significant. That is happening. In any case, you should be going to the hospital. Call your doctor, go to the hospital, and they will figure it out that what actually happened to you. Okay, now about the contraindications and reasons why your doctor will not be prescribing you this medication. Number one, of course, is hypersensitivity. If you had taken this medication and you had a strong reaction, allergic reaction to it, of course they will not give it to you again. And if you had similar medication in the past, your doctor will avoid giving you this medication. Next, breastfeeding individuals, female who are breastfeeding, should not be taking this medication. It is not prescribed, and you should be taking some other medication, and I will talk about that in other videos. Next, if you have a heart condition where one of the valves in your heart called the aortic valve, that is basically the big valve out of which all the blood goes out of the heart into the rest of the body, if that is significantly tight, then you should not be taking amlodipine, because what could happen is amlodipine will open up your blood vessels on the outside on your arms and your limbs, and that could lead to squeezing in of your heart a little more. So if you have that condition, and of course your doctor will know about it, and you don't have to worry about it yourself, your doctor will take care of it. So my dear friends, these were some of the side effects, uses, and how it actually works, and some of the contraindications to amlodipine. If you have any other medications you want me to talk about, especially in relation to high blood pressure, since that is a topic I want to cover these days, let me know in the comments below. And if you had any of these symptoms before, let me know in the comments below as well. I'd love to talk to you. Subscribe, like, and share this video. So I hope this was helpful, but if you want some more help and you want to know about the whole meal plan for what a high blood pressure person should be enjoying, I have a whole meal plan divided over 1 month's time, divided into individual weeks, and with the recipes as well as the cooking instructions that you don't have to worry about when you go to the grocery store, and you have all the ingredients for that particular week, week 1, week 2, week 3, and this can be a helpful guide for you to eat healthy. And hopefully this will supplement and complement your exercises that you are doing. So you can check this out in the description. It's free for you to use. Anyways, I'm Dr. Khan. This is what I talk about, naturally curing blood pressure. You like this? Then stick around, subscribe to the channel, and watch this video. I believe you will definitely like this for helping control your blood pressure as well. Thank you so much. Bye-bye.